Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum, the official podcast of NCPA. I'm your host, John Beckner. We're glad you could join us. Our topic today is vaccination, which remains one of the most effective and economically efficient interventions in healthcare. Here to help me do a deep dive into vaccinations and vaccines is Hannah Fish, NCPA's Senior Director of Strategic Initiatives. Hannah, it's great to have you here.
Glad to be here.
So you've been involved with vaccines and immunizations probably most of your career in some way, shape, or form. I know it.
Definitely have.
Yeah, at NCPA, you and I have worked together on a number of projects. You've worked on a number of industry-supported initiatives involving vaccines. So what's currently top of mind for you?
John, what isn't top of mind in the vaccine
Really?
space today?
Really?
For a while we thought immunizations were kind of this tried and true service, and then, things change and things get disrupted and we learn how to move forward from there. So really the top thing on my mind right now and today is heading into respiratory season and what our members and our independent pharmacists can do to prepare for the upcoming respiratory vaccine season.
So when we talk about respiratory season, with regard to vaccines, we're talking flu, pneumonia, COVID,
And RSV.
or RSV.
Mhm.
And I guess for those pharmacies that are really actively involved in immunizations, it's their time of year to shine,
Mhm.
but it can also be a stressful time of year in terms of burnout because of the sheer volume of vaccines needed to be administered.
Oh, absolutely. And the amount of clinics that people might host both inside their pharmacy and outside, whether it's with partners, employers, community locations. And sometimes that involves increasing staff or working longer hours. And so when all you're focused on for 3 to 4 to 5 months is
Right.
all vaccines, I think we as healthcare providers kind of hit that burnout of
Right.
when is this going to end? But the thing about vaccines are we talk about respiratory season. There are so many other vaccines that are year-long vaccines, if you will, and we should be having that conversation about vaccines at every point in time because inevitably someone needs a vaccine at some point in their age based on risk factors, age, etc. So how do we prep now while it's in the summer months before we hit that respiratory season? And quite frankly, COVID isn't so much a respiratory virus anymore that we're seeing.
Yeah.
And so, how do we start preparing for these cycles that we're seeing, whether it's truly in respiratory season or not, and manage the staffing, manage the mental load of having to deal with this ramp up? But how do we also sustain a service that really should be year long?
So, back when I first got involved in vaccines, it was not a year-round business. It was flu and pneumonia, and that was it. And then gradually over time, uh, immunizations in pharmacies started becoming a year-round business, which is a good thing.
Oh, absolutely.
But there are peaks and valleys, and you mentioned, we're doing this podcast in the summer months. Looking ahead, we've got respiratory season on the horizon, which is the busiest time of year. So, what can people be doing now to get ready for that?
Yeah, and I would be remiss to say that you are one of the reasons that we even have vaccinations in pharmacy to begin with. So thank you for pioneering all of these efforts that we now as a profession can help serve in such a public health role.
Well, you're very kind to say that, but I had a lot of help, and you were just with one of the leaders in that movement, Kelly Good, at
Yes.
the immunization conference that you just attended in Atlanta.
Absolutely. Yeah.
So,
That's-
so anyway, what can folks do now?
Yeah. So If you haven't already been doing this, if you're looking at expanding your business, start reaching out to the partners in your community. If you're looking to grow, try reaching out to some of the HR directors
Mm.
at your local employers that surround your areas, or reach out to the local schools that might be in your area to see, do kids need back to school vaccines? And then can we go ahead and get them vaccinated with what they might be recommended, or get their parents the recommended vaccines in one shot? Or can you create these employee wellness programs, but setting those up now, scheduling those in the fall so that you have adequate time to know that you've got the right stock on hand, that you can proactively look at insurance and how different insurances might,
Hmm.
you know, be billed, and you trying to navigate the Medicare space and the commercial space and Medicaid.
Yeah.
It's complicated, but as you
Very.
mentioned, it's still an economical, viable
It's
business.
it's definitely a good business to be in, and I think I'm really glad that you used the word partnerships because I'm not sure that there's any service that pharmacies provide that's more important or more dependent upon partnerships than
Oh,
immunizations.
absolutely.
Particularly with a lot of pharmacies engage with employer groups with these offsite clinics, and it's not something that you set up for tomorrow. You do it well in advance.
Yeah, absolutely. And I would also regret if I didn't talk about our long-term care
Yes.
community and the opportunity there, and the plethora of facilities that are out there, but also patients who might need care at home and are some of the most vulnerable patients and need that care. But trying to plan that stuff now as much as possible so that you, again, have the right staff, you have the right stock, you have all the right protocols, you have the things set up in place to be efficient, and again, do some of the things now to set yourself up for less administrative burden
Exact
later.
exactly, and when you talk about efficiency, I would be remiss if I did not mention the important role of technicians.
100%.
Which started during COVID, thank goodness. I mean,
Yes.
that was one of the probably one of the silver linings of COVID is that technicians became authorized to provide immunizations.
Yeah, that was a really exciting time, and I worked very closely with all of the efforts that were happening during
No, you
COVID,
didn't.
trying to make sure that the entire country had access to vaccines, working with all of our different partners to especially make sure that independents weren't forgotten in that mix. And so when we were working on some of that regulatory permissions and, I guess, lessening expansion of scope to try to make sure we could save the world, it was amazing to know that technicians were very much able and capable to step up to the plate. So I'm glad to see that some of that stuff has been codified into some of our statute, and we're seeing more and more technicians trained to administer.
You say save the world, and that's, it sounds dramatic, but it's probably not too far from the truth.
I think it's very much the truth. I mean, I wish I was learning how to bake banana bread during that time, but instead I was trying to help figure out which dose of which vaccine people were trying to get.
Yeah, that time seems like a blur. There was, so much, that, you heard the expression, learning how to fly the plane that's on fire.
Oh, yeah.
It's really
Literally.
pretty, definitely interesting time. So, one thing I wanted to talk about is, the last couple of years has certainly been interesting when you talk about vaccines, and there was a time where there was a steady upward trajectory of vaccines, particularly in the pharmacy space.
Yeah.
Uh, Pharmacists were those that weren't immunizing were deciding to immunize, and those that were immunizing were developing more comprehensive programs. So things were really on a very positive upward trend. But the last couple of years, with some changes, uh, we've kind of I don't want to say plateaued a little bit, but that trajectory has certainly changed. Uh, I'm curious to get your thoughts on how much that has impacted patients' opinions about vaccines in terms of, there's always been vaccine hesitancy, and a lot of vaccine hesitancy with the COVID vaccine, and even with the traditional flu vaccine, there's always been hesitancy. How much of this has been influenced by what's happened lately?
I certainly think that what is happening in the climate these days has an influence, absolutely. But to your point, hesitancy or skepticism has been around even since smallpox. I think we originally used like cow protein to make some of these vaccines, and
Yep.
I remember seeing something somewhere of like a political cartoon that showed people turning into cows because they got a vaccine, right? So this hesitancy, skepticism, general concern for what you're putting into your body is not new. Uh, it certainly has a bigger platform these days because of all of the social media and some of the extremely loud voices that are out in the world today. But there are still people that are, advocating for the benefits of these vaccines and why they are such important preventative tools in our healthcare. So when we're, talking about hesitancy or vaccine confidence, it's, all of these terms have been used in our healthcare. But when it comes down to it, I care about you and your health, John, right? I want to help you make the best decision for you. And it's also regaining the confidence back in ourselves as providers, making
Right.
these strong recommendations. And I think some of that kind of maybe fizzled away a little bit during COVID because we were doing this nonstop. We were burnt out by the whole situation. So that when everything seemed to kind of calm down, I think we all, quite frankly, have some PTSD from it.
No
And so
question about that. Yeah.
so when we're talking about the confidence and the hesitancy, I think some of it has actually come from our own provider lack of confidence in being able to say, I truly believe this. So no matter what is kind of happening in the broader sphere of things, you still have the relationship with your patient.
100%. And, at the end of the day, we're healthcare providers, but we're also salespeople. We're selling a service, and if you don't have confidence in the service or product you're selling, you can't be a very good salesperson.
Exactly.
So I think that's happened a little bit with vaccines and vaccinations, and we talk about vaccine hesitancy and vaccine fatigue. Well, I definitely think there's been vaccine fatigue on the part of pharmacists,
Absolutely.
and so we just need to be really mindful of that moving forward and try to deal with that as best we can. And I think you and I did a podcast earlier, and we talked about the importance of being good listeners.
Mhm.
I think
Absolutely.
not only do we need to listen to our patients about their concerns, but we also need to listen to each other and try to better understand our own concerns about this.
Yeah, absolutely. And I think another acknowledgement is some of the science has evolved so rapidly. And we saw that with COVID, especially. I mean, we went from having no vaccines and a virus that shut down the world to having vaccines within what, like 9 months?
Unbelievable,
So that's
really.
unprecedented. And I think that does cause natural concern for people is that, where we've had other vaccines that have been tried and true for over 30 years or longer, and now to have something that's been developed so quickly, yeah, you want to know whether it's going to be quality, if it's going to save your life, if it's going to have side effects that we haven't studied.
Right.
So I think there's still some of those like aftershocks that we're
Mhm.
experiencing. And the negative, I think, to that is it's causing people to question the efficacy and the benefit of these tried and true vaccines that we've had for a number of years,
Right.
but we're still seeing tremendous benefit. And it's unfortunate with things like the measles outbreaks that the number of children dying over the last year is, exponentially greater than it was a year ago.
Well, you've
And
got you've got a disease that, heretofore was eradicated,
yeah,
and now it's back,
yeah,
which is really scary, and it really emphasizes the importance of being able to convey a trusted message to patients and be consistent with the message that they may be getting from other providers.
Yes, absolutely. And learning how to question what they see on social media or other platforms and not to take it as gospel, but also for us as providers to not just
Yeah.
outright reject what patients might be saying to us as healthcare providers, if they've seen something out there and it's, again, kind of you were saying what we talked about a little bit earlier in another podcast about listening and being curious. Oh, you saw that. Well, what's the fear behind that? What's the feeling behind why you're saying you might not want a vaccine? And
Yeah.
trying to drill into that.
Yeah, and you want people to feel comfortable about being curious. You want
Yes.
them it's okay to question.
Exactly.
That's not a bad thing.
Yeah.
So we talked about the importance of partnerships. Talk about the importance of collaboration with the medical community when it comes to vaccination.
Oh, it's incredibly important. I mean, every patient, right? We talk about patient-centeredness and we talk about the medical home or the immunization neighborhood, if you will. And, the benefits of these vaccines are to prevent other diseases from happening, sometimes even cancers, especially as we see with the HPV vaccine. So that coordination of care needs to happen in partnership with all of the healthcare community. So if pharmacies are giving vaccines, it's so important for us to be reporting those to the registry and sharing that information with physicians, primary care, public health, because we want to be efficient with our resources and make
Yeah.
sure that we're not necessarily over vaccinating anyone. But at the same time, we want to make sure that no one slips through the cracks either and does get the vaccines that are recommended for them.
You know, we talk about collaboration. I think the HPV vaccine is a great example of that. It's a series,
Mm-hmm.
and the patient may get the first in the series at a physician's office, but it may not be convenient for them to go back to the physician. They may want to get it somewhere else, such as a pharmacy.
Yeah.
So being able to share and communicate with each other about that series and making sure you complete the series is really important.
Yeah, absolutely. And especially some of these series that have like catch up schedules to them where maybe they got their first dose at the pediatrician and then somehow never went back. And now it's, pharmacy is the convenient place to help finish the series or re engage a series because it wasn't effective if they, didn't complete it in time. So it's very much a cohesive uh, partnership that we do need to maintain and work together on.
So you were involved recently in a roundtable,
Yes.
and would love to hear more about that. The roundtable resulted in a white paper,
Yes.
and I guess the idea behind it was, uh, I mentioned the vaccines were certainly efficient and economical and the best way to prevent disease. But there's still a lot of gaps despite broader coverage than there's ever been before and really strong clinical recommendations about getting this vaccine. So talk about that roundtable that you were involved with and what came out of it.
Yeah. Uh, you mentioned earlier that we as NCPA have great relationships with some of our industry partners in our life sciences. And so this particular roundtable, I want to acknowledge the support we received from Sanofi to help convene some of these individuals. But I would be remiss to not, shout out all of the industry partners we worked with on vaccine, Pfizer,
We've
Merck,
worked with all of
Sanofi,
them.
GSK, Vaxxer, all of
Yep.
them. So I'm sure I forgot to mention someone and don't don't come at me for not giving you a shout out. But no, we really appreciate those partnerships because these relationships help us drill into what isn't working, what are those barriers that we're facing in pharmacy, and wanting to really try to identify what are levers that we can pull to potentially solve whatever those issues might be. And so what we did was we brought together, a roundtable of various pharmacists, representatives from our CPESN networks and our managing network facilitators, technicians,
Good.
to hear all of their perspectives on what makes a vaccine program successful, what are still the challenges that we're facing, and where are there opportunities to invest more into infrastructure issues, reimbursement issues, some of the burnout that we talked about. And so that's what ultimately came out of the roundtable and is in this white paper that we hope everyone will now use as a resource for advocacy, regulatory conversations, things that hopefully you can go to at your state or when you're talking to potential payers for programs to say, this is what we still need support with. It's not always just hesitancy or confidence or whatever we're going to
Yep.
call it. It's not just provider burnout. It's not just provider clinical knowledge. There's systematic infrastructure that is still preventing us from being able to optimize our ability to provide vaccines.
Combination of a lot of different things.
Yeah, absolutely.
So if someone wants to read that white paper, where would they go to find it?
They'd go to the NCPA website.
Okay.
And, on our resources page, we have a whole immunization section dedicated to a whole bunch of the resources and, talked about at the beginning what's top of mind and planning for your work, setting up clinics now. There's going to be some resources coming around how to do that more efficiently, but visit NCPA's website, click on our immunization page, and you'll be able to read our findings.
It's pretty robust. And, one thing I wanted to mention is a number of years ago, our CEO, Doug Hoy, said that he really wanted immunizations to be a core service of independent community pharmacy.
Yeah.
You think we're there?
I think we have certainly made tremendous progress. And as much as I want to say we're there, I think there's always room for improvement, John. And maybe that's the perfectionist in me to try to drive this to having every single pharmacy be able to provide immunizations. But, we've made such forward progress in the 20, 30 years since we've been able to start giving vaccines as a profession. But we're trying to get the word out of how do we help our members see that vaccines are not only a public health opportunity, but an excellent business opportunity too?
Well said. And we just need more passionate folks like yourself to be a cheerleader and beat the drums for immunizations.
I appreciate it. If I could tell more people and train more people, I would. But I know people are busy in their pharmacies and they've got to prioritize things. But
Right.
this is our plea and our call to action.
Yep.
That we promise you vaccines are worth it.
Absolutely. Well, I want to thank you for being on today. I always enjoy talking with you, particularly when the topic is immunizations.
Yes. And that's how we first met, actually.
That's exactly
was
right.
over immunization.
Yeah,
So
that's
it's so
the
good
thing.
to be here. Thanks for inviting me.
You're welcome. And thank you for tuning in to Independent RX Forum. We encourage you to continue to listen to the NCPA's official podcast on your podcast medium. Thank you.